Talking about race is uncomfortable, but it should be uncomfortable. Today's conference is important in continuing these uncomfortable conversations.
Only through this recognition and through listening to each other can we begin to lead a process to change.
Danielle and actually Deidre asked me basically to speak in their behalf because they were fed up with what was going on. When they were in pain, they were the women that were in pain, and they were labeled as drug seekers. So that broke my heart. But I had to do something. I had to say something. I had to be that voice, and he had to be that voice.
Here's the thing. In the medical community, the number one bias is drug users. The number two bias is weight. More than race, more than gender, more than orientation.
As a healthcare provider, every year we do our cultural awareness training and diversity. Click, 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 click. That sound familiar? Done. Right? But it doesn't account for when we interact with that person from another culture. What's unsaid? What's the body language that's communicating that fear, that question unasked?
One of the things that we found is that in many ways, a person's zip code is just as, if not more important than a person's genetic code.
Our country has struggled to wrestle with the idea of how do we really deal with diversity? And that struggle has really permeated not only our society as a whole, but everything from our criminal justice system to the very workplaces that we attend 5 days a week.
My story is from the perspective not only as a patient, but also as an employee and as a member of the trans community.
When you think of bias, it's all of the narratives, all the associations, all of the reactions, all of the experiences that you have formed into an algorithm that helps you to make your decisions. We're not going to talk about what we intend to do, because I believe we all have great intentions. The question is, what's the impact?
But the nice thing is, women were coming forward, providers were coming forward and say, hey, we've been talking about this in this space. We've been talking about this in this space.
So it's all about collaboration, bringing all partners in the community to work together.
If I may ask, how many of you have members, friends, colleagues who are a member of LGBT, if you may raise your hand? Thank you. The reason I always ask that is because there's no difference between you and me.
Dealing with the social determinants of health is truly about social justice and ensuring that the most vulnerable amongst us have access not only to health care, but access to economic opportunities, fair, stable housing, safe childcare, safe streets and playable areas for their children, and more importantly, have every opportunity available to them to be contributing members of today's society.